Hello, everyone, and welcome back to another episode of our podcast, IPC in Action. And my name's Jen. I'm one of the senior infection control nurses working in the Acute Trust. And today I have a lovely guest with me. I've got Amy. Amy, would you like to introduce yourself?
Hi, Jen. So I'm Amy Reid, and I'm a trainee consultant clinical scientist, which is a bit of a mouthful of a job. But what I do is I work between the microbiology lab and the clinical microbiology team.
Excellent. Sorry, I wasn't quite prepared then. So we are here today to chat about some changing guidelines around antibiotic dosing. And I'm going to leave almost all of this to Amy because she knows what she's talking about. And I'll just pitch in with the odd question if that's okay.
Yeah, that's fine. Yeah. Next month in May, we're hoping to launch a new way of reporting antibiotic susceptibility testing for significant organisms. So what that means is that the reports that come out of the microbiology lab will be worded slightly different. And for our clinical colleagues and prescribers on the wards, that might mean when they review the antibiotics for the patient, they might need to just check that they're on the right dosing. So if we go back to sort of basics and back to the beginning of this, it might make a little bit more sense.
Go for it.
When patients are suspected of having an infection, we ask that you take microbiological samples. We then culture the organisms that are causing the infection. And if we find one that we think needs treating, we then challenge that organism with a variety of antibiotics. Now, you'll have seen if you look at these results on the computer system that we report them as sensitive, so that antibiotic would have an effect on that bug and we would recommend you use it, or resistant, where it's not going to work and we don't want you to use it. And in the past, and this is where the change is coming, we used to call some bug-drug combinations intermediate, and that reflected that we weren't really sure if it would be effective on that bug and be useful for that patient. And we would, in the past, have recommended that you didn't use that and use an alternative that we knew was sensitive. But the European body, EUCAS, so EUCAST, have released some new guidance around how we test antibiotics in the laboratory. And with that, it now means that that category that we used to call indeterminate, we now know a lot more about those bug-drug interactions. And actually, a lot of those we know now that we can treat with antibiotics, but we just need to give a higher dose. So the categories you're going to see now on our reports will be sensitive. So as it's all has been, those are the ones that you can use and will be effective for your patient, hopefully. Resistant, the ones we don't want you to use. And now that new category in the middle will be called sensitive, increased dose required. And what this means is that we're now acknowledging that for some bug-drug interactions, we need to be giving a higher dose of antibiotics to ensure that there's enough flooding the site of infection and that it will be effective against the organism.
Excellent. So will the reports look the same that they do currently, but just with that addition?
Yes. So they'll look the same. It'll just be the wording that's slightly different. And it's not going to be for all bug-drug combinations. There's some bugs that this is going to be seen more often in. So our good old friend Pseudomonas aeruginosa, quite a lot of the breakpoints for that now will be increased dose required rather than S.
Okay.
But it should not affect a vast amount of bug-drug combinations, but you will be highlighted in the report to guidance that will be on the intranet.
And will that also be linked with sort of microguide and things like that so that people can access it easily?
Yes. So there will be there'll be a pathology webpage with all the information on it. That can be reached either through the search bar or through the antibiotic guidance pages. There'll be a link there. But we are also going to cite it within the microguide app as well. Okay. So lots of opportunity to look at the guidance when you get these bug-drug combinations reported.
So this might be a silly question. This is just for my own sort of interest. But if you've got, say, Pseudomonas, and you've got a couple of antibiotics that are sensitive, and then you've got this sensitive but with an increased dose requirement, which is your best one?
A lot of that work will be done for you by the consultant microbiologist. We'll release the ones that we think are appropriate.
Okay.
But what you will see, particularly for Pseudomonas, is we will be reporting very, very few as sensitive. They will all be at sensitive increased dose. But do not panic. We have always dosed Pseudomonas at a higher dose in this trust. So actually, you probably have already made the right choice. And it is about just making sure that when people are reviewing microbiology results, that they're just checking for those increased doses, that they're already using that higher dose.
Yeah.
And a lot of our empirical guidelines that are available on the intranet and on MicroGuide already acknowledge that for some bug drugs we have a higher dosing, and we've recommended that at the outset for a lot of them.
So it might just be a different way of reporting, not a huge amount in a different way of prescribing at this stage, but definitely that increased knowledge and awareness.
Absolutely. I think in a lot of cases, the patient may already be on that increased dose. It's just to raise awareness that it's really imperative that people check.
Absolutely.
If we're underdosing patients when the bug drug combination requires that higher dose, we're increasing the chance of potential treatment failure for that patient, but also we're not acting in our best interest to prevent antimicrobial resistance.
Absolutely.
So this is just an educational piece to kind of point people in the right direction with the guidance and explain the changes they might see in the coming months and ongoing after that.
How else will these communications be given out to staff?
Okay, so every report will have a comment on it that will tell you where to go and look on the web pages.
Okay.
We're also going to put something out in comms, and we have just presented it at medical grand rounds this week as well. So there should be some medical colleagues out and about on the wards that have already seen this information from Dr. Dahar, one of our consultants.
Oh, brilliant. Well, it sounds like it sounds like a fantastic piece of work that's coming through, and it's all, really evidence-based, which is exactly what we want to be doing, isn't it?
Yeah, and I think, so for the lab, this is quite a big technical change for us to start working with these different breakpoints where we've known in the past what was sensitive, what was resistant, and what we were unsure about. But now that we have all this extra knowledge, it's really nice to have more organisms that we can shunt into the sensitive category and out of the resistant category. It actually gives us a few more choices than we may have had in the past. And that comes from, as you said, the evidence base and the greater understanding that's come from the European Commission for the antibiotic testing. So it's a really positive move, and hopefully the advice and guidance that we've given will help people through the change until it becomes common practice. Yeah. But you can ask advice from the consultant microbiologists. You can ask advice from your ward pharmacists and the antimicrobial pharmacists. And then there's always the pages to refer to.
Amazing. Well, it sounds like, a great piece of work that's going to be coming out shortly.
Yeah.
Did you have any other bits that you wanted to add?
I will there's a few caveats that come with antibiotic dosing. Always. So the advice that we're giving out is only for adult dosing. There are no breakpoints specifically within our guidance for paediatric dosing. So whilst we can report the sensitivities as being sensitive or resistant or increased dose required, we don't know what that looks like for paediatric patients. So the guidance that we've produced is based on dosing for adults only. You also need to be wary that you still dose according to renal and hepatic impairment for patients. And also this is only for systemic agents. It doesn't cover anything topical. But it's all explained in the guidance, and hopefully we'll have a smooth transition and it makes sense to everyone. But please ask if anyone has any questions.
Absolutely. Well, that's amazing. Thank you, Amy, for that update. And I think it's definitely a helpful thing that we can get out there for all staff to hear about, just because it will look different for all members of staff, perhaps looking at those different results, catching up on what's going on with their patients. So thank you, everyone, for listening. And any questions, any feedback, please let the team know. And as always, we are contactable in Cheltenham on extension 3129 and in Gloucester on extension 6122. Thanks very much for listening, everyone. Bye.